For me, laser has many advantages. One, we have the fact that it cauterizes as we're cutting, so pretty close to bloodless surgery. The second is that it actually, for me, post-operatively, caps off nerve root endings. So when you use a scalpel blade, basically it's kind of like getting a paper cut. Your nerve roots are exposed, and so there's a lot of pain sensation associated with it. With the laser, we cap off those nerve root endings. Basically, the patient doesn't feel a lot of post-operative pain associated with it. And so, especially with dogs and cats, you know, that are prone to kind of grooming and licking at the area, this doesn't draw their attention to the focused area. Very easy to operate, very easy, quick learning curve. Basically, there's preset programs. It's pretty much, you know, point and shoot and then get going. Cutting through tissue, it was like cutting through butter. So I was able to basically remove masses without having major concerns and snags and causing tissue damage or trauma. Today we ended up using a very low wattage on the Wolf. We had 6 watts on the Wolf. Didn't have to go any higher than that for most of my procedures, and we actually removed fairly significant tumors or masses from pets. The benefit, obviously, with the Fox is the portability of the Fox. So it has a lithium-ion battery, which is rechargeable, and so that means that I also do equine work as well. So if I wanted to go out into the field, or if you have a person who's doing mobile practice, the flexibility of the Fox, where it can actually provide activity for EmunDo, stimulating a infracyanine type dye, and then actually trying to kill off bacteria, and doing a good job at that with deeper penetration. Also the fact that we can actually use this for low-level laser therapy. I can see where the flexibility of this unit would actually come into play, especially in a private practice type situation or a mobile practice. Laser implies technology or advanced technology, so I think clients are more apt for us to kind of move ahead with a laser procedure than talking to them about standard stainless steel cutting a mass out and everything. Especially when we start to explain the benefits of decreased inflammation, decreased post-operative pain, decreased post-operative secondary infections, which is something that's actually becoming a big issue right now. With the laser, the benefit is that it actually vaporizes all those bacteria, so there's definitely a significantly decreased chance of developing secondary infections post-operatively. As we've seen today, we did most of our procedures, actually all of our procedures, under sedation and a little bit of analgesic medication. So basically for our patients, they don't have to move forward and get into the general anesthetic where there's a higher risk of potential, you know, adverse reactions and maybe even death. So with sedation, our pets are awake and they're able to actually tolerate the laser as compared to doing multiple procedures with surgical stainless steel.